Hi, welcome to Sunday's Instagram Live. So today I'm going to talk about weight changes during the perimenopause and menopause, and about how our hormones can change the way that we look, the way that we feel, but also our weight as well. I've had loads of questions, so thank you ever so much. It's really useful to see your questions, so then I can try and tailor this half an hour into what you want. As some of you know, I don't have my glasses on, so therefore I can't read the comments. There is someone from my team who might be able to answer the odd thing, so don't think if I'm rude, I'm ignoring you. Now, the next 30 minutes I'm going to be talking about this topic, but I'm not... I don't have qualifications in nutrition. I know sometimes it can get quite heated whenever I put anything out. So this is just as a medical perspective, just giving you some basic information. So many of us, myself included, think quite a lot about weight, and it took me years when I was younger to realise that there are some genetic influences about our weight. There are certain ways that we'll never look, even if we really try. So my body shape is not going to be the same as my best friend's, or someone else I know, or some of my patients. We are all have different sort of predispositions to how we look, and also our genetic makeup is quite different, and that can alter also between different ethnicities as well. So it's really important to know that we're all not going to look the same. Isn't that wonderful that we're not all the same? So I was very fixated about my weight actually when I was at boarding school, and I did for a year or two have an eating disorder because there were various things going on in my life that made me feel very unhappy. But then actually it took me, when I was a medical student, one of my friends said, "Louise, you're always going to be flat-chested, you're always going to be pear-shaped, you're never really going to change that much." And it was actually for her telling me that made me think, actually, let me just enjoy my body. Let me just think about what I can do to optimise it, rather than being in control, trying to change in a certain way. I'm never going to change my height, and that's the same. So it's just important to set the scene, I think, because otherwise we can put ourselves up to failure. And when we have external pressures on us and then changing hormone levels, they can all just fly against us as well. So we know there are lots of hormones that determine our weight as well. Our hormones, as you know, are chemical messengers that go into our bloodstream and affect every single cell in our body. And we have all sorts of hormones in our body that determine our metabolism, so how quickly we burn off food, and the way that our bodies look as well and function. So I'm really obviously a specialist in our sex hormones, so estrogen, progesterone and testosterone. But as I've said before, they all interact with other hormones as well, and there are also other hormones that we don't always know about. There are some that I'm sure we'll find out in the future, but when I was at medical school there were certain hormones that we didn't know then that we do now. So our hormones all interact with each other, and they can affect the way our metabolism works. Now, as many of you know, the perimenopause is the time when our hormone levels fluctuate and change. So it's usually our estradiol, progesterone, and our testosterone level declines with age. It doesn't normally have this chaos up and down. It normally just declines slowly as we get older. Now, these hormones work together, they work with other hormones, including our thyroid hormones as well, and determine the way that we metabolize substances in our body, but also they affect the way we metabolize our insulin as well, so the way our pancreas works. And this is really important when we look at our glucose metabolism. And I've mentioned this before when I did a very basic Instagram Live about the biological role of our hormones in our body. We've all had friends or people that we know who can just eat anything and they always look the same. They don't put weight on, whereas other people just seem to sniff a bit of chocolate and they feel that they're putting on weight. And so our internal metabolism, if you like, is different, and it can be determined by different things. So it can be determined by the type of food we eat, the type of exercise we do, even the amount of sleep we do, whether we're stressed or not. All sorts of things can determine how our bodies put on weight or lose weight, and we have this constant processes going on in our body. Now, when our hormone levels fluctuate and reduce, when we have low estrogen, it can put more sort of strain on our pancreas. So our pancreas is our organ right tucked back at the back of our bodies by our backbone, actually, and it's the really important endocrine organ that produces insulin. So this is our hormone that regulates sugar, our glucose, and so we know that if it doesn't work well, then people can get type 2 diabetes, which is when the body doesn't respond to insulin in the same way. If it doesn't produce insulin, then people get type 1 diabetes. But type 2 diabetes, for some people, not everyone, but some people, can be related to a lifestyle. And we know more and more that people who are overweight, who have other inflammatory conditions, are more likely to have type 2 diabetes. Now, some of this is thought to be related to our pancreas having to sort of squeeze out insulin at different times to respond to the way that we eat. So if people have food that is very processed, that's very sugary, you get this big surge of insulin that comes out from the pancreas, and this surge, this peaks and troughs of insulin, affects the way our glucose levels are. And that can be quite damaging to our body, having these peaks and troughs going on all the time. If we don't have much estrogen, and also progesterone and testosterone, actually, when all those hormone levels are low, it can put more strain on our pancreas. So a lot of people talk about the menopause being a metabolic problem. It's not just something that causes a few flushes and sweats. It affects our metabolism, and it can indirectly be sort of have adverse consequences, if you like, on our pancreas and the way that we produce insulin. And this is one of the reasons that people who are menopausal have an increased risk of type 2 diabetes, even if they don't change their lifestyle at all, because estrogen is very protective. And certainly I did a study, or I was involved in looking at the results with Tim Spector and the Zoe team. It's called the PREDICT study, and looking how lots of inflammatory markers and glucose metabolism really change during the perimenopause and menopause. And that study was written up in the Lancet, and I'll try and remember to put it on my story so you can have a look for those who are more interested in the sort of cellular and more academic processes, if you like, that go on in our bodies. But it's important to know that. And obviously our glucose can be affected, but also our metabolism, so the way that we break down the food and produce energy as well, can alter if we don't have those hormones. Now, for many years as a GP, this is another confession time, I'm afraid, for me, I spoke to many women over 20 years as being a GP, and they'd come and say to me, Dr Newson, I'm not changing my lifestyle, I'm doing the same amount of exercise, I'm eating exactly the same foods, yet I'm putting on weight. And I would sit there and think, well, how's that happening? It doesn't make sense for what I learned from medical school and what I learned as a postgraduate. Why would someone just put on weight if they weren't changing the energy they were expending or the calories that they were putting into their mouth? It really didn't make sense. But I was very privileged. Where I worked as a GP, I was in the same practice for 20 years. And a lot of my patients, in fact, all of them really, were lovely people. And I really trusted them. We had a very good, I still do with my patients now. I trust them and they trust me. And there's lots of things that we share in that consulting room that I wouldn't share, clearly I wouldn't share elsewhere because of confidentiality, but they often hadn't told people as well. So when you've got this trust, and someone's sitting there saying, I have not changed my lifestyle, yet I've put on a stone, 2 stone, and why is this happening? Of course I have to believe my patients. So when something doesn't quite fit in my brain or what I've learned in the past, as many of you know, I'll go back to academic papers, I'll try and work out the pathophysiology and try and understand what's going on. And actually it took me many years to realise how important our sex hormones are at controlling our weight. So we've known that people who have an underactive thyroid gland, if they're hypothyroid, then that can change their metabolism, slow down their metabolism, and mean that many people with underactive thyroid glands put on weight. As soon as they have thyroxine back, they often find that their metabolism improves and that their weight reduces. Now that's exactly the same for estrogen deficiency and probably testosterone deficiency. Now one of the frustrating things, as many of you know, is there's very little research in this area, and I have been to many conferences where some of the lecturers have said people don't put on weight in the perimenopause and menopause. Well, I certainly have seen it and witnessed it, and even myself when I was perimenopausal, before I realised that I was perimenopausal and experiencing all these symptoms, I remember sitting in the car and the seatbelt going across and looking down and thinking, gosh, I've got this sort of roll that's happening in the midline. Why is it happening? This is really awful. And I remember my mum coming once and said, oh Louise, you put on a bit of weight. And when you're feeling awful and you just feel like you've got this demon in your mind and you want to shout out at people, the last thing you want is someone telling you that you've put on weight when you know you have. Now there are lots of other reasons why we put on weight as well in the perimenopause. So I've talked a bit about metabolism. So that's if you haven't changed your lifestyle at all. Some people, not everyone, find that they put on some weight because of the metabolic changes that occur. The other thing is that many of you know is that our bodies are designed to produce our hormones because they're biologically active. They have important physiological roles in our body. And so if we don't have estrogen, what does our body do? It tries to make it elsewhere. I've already said before that it's not just our ovaries that produce estrogen. We also produce estrogen in our brain because it's very important the way our brains work to have our sex hormones, and also in our bones and our muscles produce estrogen and testosterone, and also actually our heart cells produce some estrogen too, and our adrenal glands. But the other place that produces some estrogen are our fat cells. Now, I've also said before there are different types of estrogen. The most important anti-inflammatory good estrogen, if you like, is estradiol that's produced in these areas. But our fat cells actually produce a type of estrogen which isn't so commonly there in our body, but it's called estrone. And it works metabolically and biochemically and physiologically differently to estradiol. But it's all our body gets. If we can't get estrogen elsewhere, our body is quite clever, obviously it tries to compensate, and it says, right, I'm going to make some estrogen from the fat cells, and it's usually the fat cells in the midline. Now these fat cells, they produce estrone, which is a very weak type of estrogen. So you need a lot more of it to have the same biological effects. But it's also pro-inflammatory, so it increases inflammation in the body. So when I've spoken before about all these amazing beneficial effects taking HRT in the body identical way, has, or our natural estradiol has to protect us from diseases, we don't have this effect with estrone. And there are some good papers showing the difference between estrone and estradiol. So we know that when people have put on weight, they produce more estrone, which is pro-inflammatory, which can increase risks of all the inflammatory conditions. But we also know that our fat cells aren't just like lumps of butter stuck under our skin. They're actually metabolically active. So they produce estrone, but they also produce other cytokines, other chemicals that are very inflammatory as well, and actually quite toxic for our body. And this is why we know there are so many diseases associated with obesity, and obesity has now overtaken smoking as the most common cause for all cancers. And that's, I'm sure, related to all these chemicals that our adipocytes, our fat cells, produce. When I was a medical student many years ago in the 1980s, I was taught that our fat cells were very inactive, and they're not at all. And so we're all different, obviously, but we need to know that our fat cells are not just making us look different, they're actually having a detrimental effect on our bodies. But they are producing some estrogen, but like I say, it's not the best estrogen. There are also other reasons why people put on weight, and I certainly know personally I did, because when you have low estrogen levels, it's exactly the same as when you have low estrogen levels just before your periods. And during that time, often people have sugar cravings. They feel really I've had it before, where you feel like all you can think about is having something sweet. It just fixates in your brain. And at the time when it was happening to me, I thought, oh, it's a psychological thing. Or sometimes I get cravings for certain foods when I've got that aura, when I know I'm going to get a migraine. But this feels slightly different, and the more I speak to people, they say the same. And it's because of the low estrogen and the low progesterone as well. And so a lot of people say when they have body identical hormones that replace the missing estrogen, whether it's throughout the whole cycle as we give in perimenopause or menopause, or whether it's just for a few days, as in when we give for women who've got PMS and PMDD, those sugar cravings reduce. And that's because we've got the estradiol that's balancing our sugar levels and our insulin levels. So people can, if you have sugar cravings and eat more sugar or more processed food, of course, then you're going to possibly put on weight as well. Then also, often people feel more tired. They have muscle and joint pain. They have less motivation, less enjoyment of things. So if you ask many menopausal and perimenopausal women, do you feel like exercising? Then quite often they'll say no. And I felt the same. I really didn't want to do yoga. I just thought, I really can't be bothered. I've got no oomph, I've got no motivation, I've got no drive. And we all know the less exercise you do, the easier it is to slip away from it. I'm really, well, I would say obsessed, but I do yoga at least once every weekend, and I try and do it alternate days, and I do it every Wednesday, and it's just built into my diary, because if I don't, it would be so easy to forget about doing exercise, especially when we're all busy. But it's really, really important. We can't have an exercise pill, and some of you might have listened to the podcast I did with Dr Hussain recently, and he talks about movement rather than exercise. But we know obviously if we move, it helps our metabolism, it helps our muscles to be stronger, it helps us mentally as well. There are all sorts of beneficial effects. But if we're not exercising and we're eating in a different way or eating more, then of course that's going to increase our weight as well. So lots of things are against us when we're perimenopausal and menopausal. But we shouldn't be feeling failures. We should be thinking, well, what are we going to do about it? So obviously often people say to me, I'm really worried about taking HRT because I know when my mum took it or my auntie took it, she put on weight. Now, I've already said there are different types of HRT. Usually, certainly in our clinic, in the Newson Health Clinic, we prescribe body identical hormones. So what we're trying to do is replace the hormones that are missing. So it's usually a combination of estrogen, but we give the pure estradiol. So through the skin as a patch or gel, occasionally the spray is the estradiol, the good estrogen. And then we give the natural progesterone as well, usually as an oral capsule, but sometimes vaginally, and then it's absorbed as pure progesterone in the body. And then we often give testosterone as well. And testosterone has often been neglected when we think about weight, but it can be important as well. And our clinical practice shows that people who have testosterone often find that they mentally feel better, they physically feel better, they're more likely to sleep, they feel more motivated, they've got more stamina. But actually when we exercise, we've got cells that respond to estrogen, progesterone and testosterone in our muscles and our bones. And so I've spoken about it before, but women who are older and menopausal have an increased risk of this condition called sarcopenia, which basically means reduction and loss of muscle mass. So a lot of people say to me, even though I'm exercising exactly the same, I'm not building muscle in the same way. And in fact, my muscles are wasting. I don't look the same, doesn't feel the same. I can't feel my muscles in the same way. And that's often if people aren't taking hormones, that can happen. So a lot of people, when they're on the right dose and type of hormones, usually with testosterone, find that they can build muscle the same that they were before. Now obviously we don't give too much testosterone, we just replace what's missing, so people aren't going to have big rippling muscles that you imagine if people are on testosterone, but they just find it easier. And actually this is anecdotal, this is just from talking to hundreds or thousands of women, that often people say, and I know myself as well, people who use testosterone don't have these sugar cravings. Because you just don't think about food in the same way. And if show me a plate of donuts, I'm actually not interested. Whereas 15 years ago, show me a plate of donuts when I'm hungry, I would have probably had 2, maybe 3, and then felt a bit sick. I just haven't got that sweet tooth in the same way. And some of it is I've trained myself because I eat differently, but also I just don't have that same cravings that I used to because my hormones are balanced. And a lot of women say that as well. So it's important to think about how your hormones have a role in your metabolism, in the way that you crave food, but also enabling you to have a better lifestyle as well. And plus there are all sorts of other benefits of having our own hormones back, which I have spoken about many times before. Now, there are other types of HRT, so the one that you might have had a relative who put on weight on is often a tablet estrogen. Now, the tablet estrogen has to get metabolized and broken down. So everything we put in our mouth, obviously we've got enzymes, we've got chemicals in our body that break down anything that we put in our mouth, whether food or whether it's a drug, and it ends up going to the liver. And our liver is like a filter really, and it detoxifies, it breaks down any substances more, and it's like a filter before things go into the bloodstream properly. Now, when estrogen is taken as an oral tablet, it gets metabolized, broken down. So the estrogen gets broken down to different types of estrogen. And guess what? It gets broken down to estrone. Now, I've already said, if you remember, estrone is this pro-inflammatory type of estrogen, which our fat cells also produce. So you don't really want to be having estrone unless there's a reason. Some people have an oral estrogen, but most of us don't, because we want to have the pure estradiol. And so if you've put on weight because of your HRT, it might be because you're having tablet estrogen. So it's worth talking to a healthcare professional about changing. The other thing is, if you are on a combination tablet, unless it's the body identical Bijuva in the UK or Bijuva in the US, it will contain a synthetic progestogen. Now, synthetic progestogens, as I've said before, have different metabolic effects in the body. What they also do is that they can cause some fluid retention for some women, and so some people find that they put on weight very quickly if they take the synthetic progestogens. Same as with the contraceptives, actually, they contain synthetic progestogens as well, so people then find they feel a bit bloated, they might have some fluid retention, their legs might feel a bit puffy. That's not the same as putting on fat, but it will put on weight, because anything with fluid is going to weigh more as well. So if people have put on weight quite quickly, it might be because of the synthetic hormones. Obviously, our hormones take a while to work in our body. I've already said they have effects that affect our cells, but they the cellular processes, and then they also have effects that affect our genes. When they affect our genes, it can take a few months to have an effect. So some people say, oh, I've put on weight, I feel dreadful. It might be a short-term thing, so just persevere and then see what happens. But like I've already said before, often people find that their dose and type of HRT needs changing. So if women don't have enough estrogen, and we see a lot of women in our clinic who are on HRT and they say it's not working, but when we look at what they've been given, it's often a very low dose, or they've been given a sort of average dose, but they're not absorbing it properly. Now, we know, and there are some great studies that have shown, that if people have low estrogen in their bodies, you get this pro-inflammatory effect. So if you have increased inflammation in your body, then it can reduce your metabolism. It will increase your risk of the inflammatory diseases as well, the heart disease, osteoporosis, diabetes, dementia, and so forth. Because our inflammatory cells are really good at protecting us from infection, so they can be anti-inflammatory, but if they're not in the right microenvironment, they can be pro-inflammatory, which means they can lead to more inflammation. And we know that if people have low estrogen, or they have the estrone in the circulation, it can cause a pro-inflammatory effect, so increase inflammation. So if you're on a body identical hormones and you're putting on weight, it might be because you don't have the right amount of estrogen, and it might be that you're not having testosterone as well. So all these things are really important. That's why it's very important to get a holistic approach with your healthcare professional that you see. Now, I've already said before, and I will say again, that a calorie is not a calorie. So there's lots of people, and now even when we go for a meal, isn't it, they put on how many calories on each meal, or you know, if you buy anything now, you look at the label, it will tell you how many calories everything are in. And I don't need to tell you that if I had 100 calories, for example, of almonds, or 100 calories of chips or chocolate, of course it's going to have different effects in my body. It's not rocket science, but we've been sort of hoodwinked for many years that calories are the same, and of course they're not. How can they be? And what we eat when we're younger, you know, my teenage children, they can eat the same as me and I will put on weight and they won't. So just getting older will change our metabolism. We can't blame everything on hormones, but we have to think really carefully about what we eat. Now there's some great people doing some amazing work looking at our gut microbes, which I've spoken about before. And it's really important as we get older. It's so much easier to eat badly. When I was growing up in the 70s, we didn't have processed foods, we didn't have takeaways, we didn't have all these convenience foods. We just had to go back to the basics. And I feel very strongly, and so do others, that we should also be going back to the basics. So we should recognise our food. We should know the source. We shouldn't really be eating food where we can count our calories. Most of the food I eat is natural food. It's chopping up, you know, vegetables. It's you know, buying meat rather than something that's pre-made. If I'm going to do a pasta sauce for the children, I will do it myself, put it in a blender, make a massive vat of it, and then portion it up so it's all in the freezer, good to go. So I bulk cook a lot, but it's very important to have as much fresh fruit and vegetable as we can, because that will feed our gut microbes. And certainly if you look at people like Tim Spector, Michael Mosley, I've got a great podcast coming out on Tuesday with lovely Dr Rupi. We talk a lot about how important foods types are on our gut microbes, and others, they talk a lot about it. So that's important, worth looking at, because that can affect our metabolism as well as how we feel as well. And then looking at our exercise, now there's a big debate whether exercise per se will reduce weight, but it will change the way we look. The other thing about weight is, don't just get on the scales all the time. I got on the scales this morning and then I got on the scales tonight, and I weighed 2 kilograms heavier now than I did this morning. Now, I don't know why. I think it's just because I must have drunk more, and I just think I would get so obsessed if I was weighing myself too much. Also, we know that muscle weighs more than fat as well. So if you're physically fitter, you might find that you've put on more weight on the scales, but your clothes fit you differently and you look better. So I think we have to be really careful when we're thinking about weight as well. But also some people will tell me that they're exercising more and more and more, and they're putting on more and more weight and they're not changing anything else. We need to think about what other hormones are released when we exercise. And some people find that when they're doing a high intensity workout, they have more adrenaline and more cortisol, and they have more stress hormones. And we know that if there's increased stress, it will alter our metabolism, and it will put more surges on our pancreas. It will cause more inflammation in our body, and guess what? We'll put on weight. I don't need to tell you how converted I am to yoga, but it's important to find an exercise that's right for you. So looking holistically, not just am I going to pump up and get good muscles, it's like, what's it doing to my brain? What's it doing also to my pelvic floor? Because we know pelvic floor weakens during menopause and perimenopause. And what's it doing to my whole body? And it might be that you need to alter and change the way you exercise as you get older as well. So there's also quite a lot of talk about protein. There's many people who don't eat meat, or they don't eat fish or meat, or they're vegan. We have to be really careful looking at about the amount of protein that we have in our diets. And there's more and more work looking at how metabolically active our muscles are. So we do need to build our muscles because it's very beneficial for us. And like I've said before, if we have strong muscles, we're going to be fit fitter, we're going to be more active, we're going to be able to get out of the chair, we're going to be able to get out of the bath unaided, we're less likely to fall, and if we do fall, we'll pick ourselves up. So it's investing for our future health as well is really important when we think about muscles, we think about protein, we think about what we eat. Now, another thing that somebody asked me was about bloating that they're getting and some sort of reflux type symptoms. Now, that can be very common during perimenopause and menopause, often due to our hormones, because we have hormone receptors on the cells lining our gut, and especially testosterone. I find in my clinical practice that a lot of people have irritable bowel type symptoms and bloating, burping, reflux that can improve a little bit with HRT, but once testosterone starts to work, they often find that their symptoms really melt away. So it's just something to think about as well. The other thing to think about actually is that where we eat, it's not just our digestive system, it starts in our mouth as well. And I have said before that actually all three of our hormones are really important for our oral health and dentition. We know lots of people have problems with their dental hygiene, and they can have problems even with their mouth, with sore mouth or burning mouth related to their low hormones. And if you've got mouth symptoms, you probably not going to eat as well. But the other thing is, did you know that our taste can change when we're perimenopausal and menopausal? And that's often because our taste buds can change without our hormones stimulating them, but also our sense of smell can change as well. So we might find that we don't enjoy food the same, or our sort of enjoyment of certain types of food changes too. And that can often improve when people have their hormones back. But it's just a subtle thing that's worth thinking about as well. Now, the other thing to think about also is it's not just externally what people look like, it's internally what's happening to our internal, our visceral fat. So we've got external fat and internal fat. Now, when you're looking at being healthy and trying to reduce risk of diseases as you get older, which we all want to do, certainly as a doctor I want to prevent disease rather than treat illness, looking at the distribution of fat can be really beneficial. So if you've got more fat in your internally around your organs, we know that is a marker of an increased risk of diseases going forward. But how do you know that unless you cut yourself open and look inside? Of course, we're not going to do that. Well, you can do that with quite a few DEXA scans. So DEXA scans are for looking at bone density to diagnose osteoporosis or osteopenia, which I've spoken about before. But some DEXA scans, and certainly the one we've got in the Newson Health Clinic in Stratford-upon-Avon, you can do body composition as well. So it gives you a really great picture. Might not be great depending on your body composition, of course, but it looks at, and you get the sort of red and orange, like the hot spots where the fat is, and also it will look at your muscle definition and your sort of muscle density, if you like, as well. And that can be very useful because I've seen quite a few patients who've gone in our DEXA scan and they look quite slim and lean, but actually their body fat is greater than they expect. And if they are going to start doing exercise and change their weight, then it can be quite a useful way of monitoring, and it's quite rewarding if you see that your visceral fat has reduced, and a bit depressing if it's increased. But it's just, that is a way. I'm not saying that everyone needs a DEXA scan to do the body composition, but if you are having a DEXA scan, which I've already said everyone should have a DEXA scan looking at their bone density, then it would be worth asking when you book it, is this machine able to do a body composition, and can I have one done at the same time? It doesn't take much more to do that. Now, someone asked about Ozempic. Now, I don't prescribe Ozempic, no one in my clinic does. It has been marketed and hailed as a wonder drug, and there are a lot of people that have lost a lot of weight with it. Now, one of the problems is we don't know the long-term effects, and certainly I've spoken to quite a few people who are really struggling to get off it when they've reached their target weight. I always think in medicine, let's try and do things as naturally as possible. Treat the underlying cause, and let's try and change lifestyle and try and invest in some time now, because it will reap dividends going forwards. So you have to be really disciplined with food, because we all have to eat. It's not like even giving up alcohol or cigarettes. you don't have to drink, you don't have to smoke, but we have to eat. So finding food that's pleasurable, that's rewarding to eat, that's not too much of a chore to cook, is really difficult actually. But the more you do it, the more you get into a routine, the more you try not to buy processed foods. It can be really good, and try and involve whoever's living with you at home as well. And I'm not saying everyone has to eat perfectly. A lot of people talk about the 80-20 rule. So, 20% of your time you can slack a little bit, but 80% of the time try to really think about what you're eating. Now finally, before I finish, I've talked a lot about increasing weight, but eating disorders actually can rear their head again during the perimenopause and menopause. And so I see a lot of women who've had an eating disorder when they're younger, and then it's crept in when they've become perimenopausal or menopausal. And that's partly because of our hormones changing the way we think, of course, I've said that before, but also if people are putting on weight, it can be even more distressing when people have had an eating disorder before. So it's important to know that, because we know that managing with hormones can often improve, but we need to do that sooner rather than later, because we don't want the psychological impact of having an eating disorder really affect people adversely. And also, when people have eating disorders, they're more likely to switch off their ovaries at an earlier age and become menopausal, and that can be adversely affecting their bones and future health as well. So I just thought I'd mention that, because it's important that we think about as many people as possible when we're talking about weight changes during perimenopause and menopause. So there's a lot of information there. I will put some links on my story. Listen to my podcast with Dr Rupi. I've done one with him that came out at the end of last year, but we recorded this one as well on my podcast, so that's coming out on Tuesday, so enjoy it. Next Sunday I'm going to be talking about migraines and hormones, because that's something that's very close to my heart as a migraine sufferer. You may have seen that I put on my story about my daughter Jessica, and I've done a podcast with her. Katie Monroe is a brilliant advocate talking about menopause and hormones and migraines as well. But I thought I'd just go through some basics about what migraines are, how hormones can interfere, and treatment options as well in a holistic way. If you've got any other questions that you want to ask, put them in the comments when I've put this on the grid. And if you've got ideas for topics going forwards, please send them to me, and I will keep going with the Sundays as long as you find them useful. So enjoy the rest of your evening. I hope that's been beneficial for you, and thanks for joining me.